Hey guys, this is Travis with Beyond Bipolar blog. I'm featuring my brother here, Kyle.
Hello.
Today we're going to do a reaction video to a channel called the Aspie World. The reason why I'm doing this is because I promised Suz Dwyer. She was a commenter on the video reacting to Josh Hitty's Social Anxiety No Friends video. She commented on that and we're talking quite a bit. She mentioned that she has autism and she does stemming and many other things like that. I'm going to share her link. She only has one subscriber, but I'll share her link in case you want to reach out to her. Since she has no videos, you can't really comment, but feel free to comment on reacting to Josh Hitty's Social Anxiety No Friends video. I will post that as well. I'll also post the Aspie World channel. And today we're going to cover 10 Asperger's symptoms, autism, and Asperger's. Now, the reason why I'm covering this is, personally, I've never actually been diagnosed with autism, but my brother, unfortunately, was trying to get this label so much that he convinced his therapist that he was autistic. Do you have anything else to say about that?
Yeah, I wanted to discuss about that. The interesting thing, though, is that that you used to suffer from sensory overload, that it hurt your ears playing music, and,
Right.
and you couldn't see outside. So why wasn't that autism? Why is that bipolar?
I want to say because when I'm in a low state of mood, I am very sensitive to sounds. I'm very sensitive to light, and not only that, some medication like antidepressants I want, like Trintellix, exasperated the light sensitivity.
Is that typical with bipolar people, though? Light sensitivity. That seems more autism to me.
It's very possible that we might have Asperger's or autism, and I don't know if you guys don't know this. I think Asperger's been.
Keep going.
I believe Asperger's actually been taken off the DSM or whatever they call it, the DSVM. I don't know what it is. It's just the categorization of mental illnesses. And they took this off, and it's just called autism. It's on the spectrum. Asperger's is usually high functioning.
So my brother and I both have a bunch of records. I actually kept a whole bunch of my personal records. It's a really, really thick binder. It's got to be like 6 inches. But anyway, I did a test, and this is really interesting to me because I felt like I had something, because we just don't, especially when I'm dating, it's really weird that we do interviews. We like to delve deep in the mind, yet in reality, we don't really listen or really know how to behave. Maybe it's antisocial behavior, but when I was dating a girlfriend, it's think I don't understand them. Maybe I just don't understand women in general, and maybe it's just more of a man thing, because I do believe men and women think differently. But anyway, this is kind of an interesting subject. My brother has.
I had really poor self-esteem.
My brother really thought he had like some sort of what is this? Explain it.
Fetal alcohol
syndrome too, which apparently we weren't.
And I was actually trying to compare our mouths, since we have like an bimaxillary protrusion because our mouth sticks out. I thought that we had fetal alcohol syndrome. I thought that we were autistic. I was trying to just throw anything out there that pretty much took me away from being bipolar, because I wanted a more concrete answer to the reason why I'm suffering so much in my life.
So why don't you just go look here, Travis? So could you bring the camera down? So I'm just going to take a little deeper look. Both my brother and I did take a psychological test.
Is there any scores that?
And I went to Nystrom, bring it back more, and I took 2 tests, I remember, and basically I was striving for autism. I actually don't have ADHD, DTV, I actually don't have ADHD.
How long was this test?
Anyway, this test took like 2 days, and
what are the results?
The results, basically, I had pretty good IQ, I guess. Average. General ability, high average. I don't know what that means. Mostly I scored high average. I don't know what working memory is, low average, but I scored normally on cognitive mainly things. But I guess when it comes to autism, it's more about emotional reading people, and maybe we had such social. The thing is, we didn't have a lot of friends. We had one really good friend we used to hang around, and because of the relationship with my brother and I being twins, we probably just didn't really learn social cues as much as we could. I feel like it's weird. I feel like I can read people, but maybe I can't read people. But I don't know. I have this intense conflict to withdraw from personal relationships because his fear of independence, like my brother and I. The fact that what they really labeled me with is autism spectrum disorder requiring support without accompanying intellectual impairment. So they did kind of relate me with having autism, actually. So let me see here. But yeah, I took this test like multiple times. I took it twice, and hold on a second. I'm just trying to look here. So they call it the DSMV-5, and there's probably a DSMV-6 out by now. But anyway, they said that I might have a little bit of autism, and why do I feel like that is because when I date, a lot of women think I don't really. I don't really. The thing is, I don't listen.
How do they
I just
scale?
do what the hell I want.
How do they scale that you're autistic here, though?
So let me see, Deborah. So let me just read the final postings here. Sorry a second. I don't want to take too much time here. So basically, I have pretty good intellectual abilities, executive abilities, even above average. And
this was done.
Okay,
this was done when he was 24, and we're already 34. This was done 10 years ago.
Okay, so taken as a whole, the test finds do not provide consistent or compelling evidence of a brain disease. He certainly does not appear to be encyclopedic. I don't know what that means. The MMPI is technically invalid due to symptom over-reporting. In this case, overt malignance is unlikely. At this point, I don't think he meets diagnostic criteria for schizophrenia or schizoaffective disorder. I agree that he has anxiety disorder with obsessive compulsive and social phobia features. There are clearly oddities to his thinking, with paranoid notions, occasional auditory illusions not explainable on the basis of an anxiety disorder. Possible include a personality disorder, paranoid, schizotypal, and schizoid features, such as paranormal schizophrenia. Although it's hard to nail it down to definite psychotic spectrum diagnosis, he nevertheless might benefit from antipsychotic medications. I've heard of Dr. Olson's and Gorky in writing of a specific treatment plan. So I'm trying to find it, but they basically said that I have a relation. Hold on, I'm trying to find it. I know they said that I have. These are actually all my therapy notes. I know. He said. I know. Let me see. So I know I'm trying to find the evaluations. I know they said that I have that they consider my relationship with my brother a disorder, and I'm trying to find.
What does that have to do with autism, though?
But it's interesting because they really alluded that. So, 1 second. So I was 27 here, so I actually did a newer one. So this is the newer one. Let me see here. Sorry. So now you can see I'm pretty much above average in memory. But anyway, I guess we can watch the video. I'm going to look for it and I'll listen to what Travis has to say. But I know that I'm trying to find the exact spectrum. So basically, autism spectrum disorder requiring support without accompanying intellectual impairment, without language impairment. That's basically what I've been diagnosed with. And somewhere I saw that they consider my brother part of the sibling relational problem. It's right there. So basically, Axis 1 clinical syndromes. They labeled me with autism spectrum disorder, requiring support without accompanying intellectual impairment, without language impairment. 311 unspecified depressive disorder, 300 unspecified anxiety disorder, and 61.8 sibling relationship problem. Axis 2 personality disorders deferred. Axis 3 general medical addictions, allergies. Axis 4 psychosocial environmental problems. Brother's mental health issues. Father has health issues. Global assessment of functioning. GAF 52 moderate depression, sleep issues, social difficulties, impaired social, academic, and occupational functioning. So we'll watch the video, and what my really belief is, I think I know a lot of kids grew up shy. We grew up really shy. We couldn't really get along with people because we were afraid with the social anxiety disorder, but we just kind of grew out of it. And I think that's kind of what it is. It's mainly just we grew adapted. So let's watch and figure out what this guy says about
So the
autism.
Aspie World, I'm going to watch 10 Asperger syndromes, autism, and Aspergers. I'm going to speed it up to 1.5 just in case if the video is too long. I really don't want to take too much time here. I'll skip this ad, not trying to promote any ads here. It's fine. Playback speed 1.5. This is a really short video, so we'll see what...
I'm 26 years old and I have Asperger syndrome, and these are my top 10 Asperger traits that you may find helpful. Number 1, sometimes when I'm nervous or concentrate, I flick my fingers and I don't even know I'm doing it, but my girlfriend seems to notice quite quickly like that, just to soothe, and it helps me concentrate, and I normally get it when I'm quite nervous around other people. Number 2, for me, is change in routine. So if I've got something in my head that we're going to do or I'm going to do, and something comes in the way of it, I get really upset and nervous if it's challenged. Like if we're in a sandwich shop and we're going to buy sandwiches and the bread I want isn't in, I get really nervous and then I start to panic because I don't know what I'm going to do because I don't know what bread is available and other things like that. So this can become...
I hate to say this. You used to be very OCD in particular.
I used
with
to
cleaning,
be, with cleaning,
especially with
like putting a
organization
coin on my bed. When I was playing video games, everything had to be in this perfect situation. Have a clean bed, a clean place when I play Final Fantasy. And I think I could tell this guy does have a little bit of autism because, one, he's not really looking at the camera and he's pretty nervous. Otherwise, it could be some anxiety disorder. But
a problem for me, and I guess routines are quite comfortable to me in everything I do. Foods are really important to me, as in I like eating maybe a small selection of foods. I don't like anything with any sauces or anything. I can't have sauce texture in my mouth, and if I do have sauce like gravy, it's got to be...
I love food. I like Korean food. I like American food. And the thing is, Colin and I are bodybuilders, so we focus on our diet pretty frequently. So I don't think we have an issue with food at all.
Warm, I can't have anything cold, and I can't eat food if it's...
Hold on, let me see what the first one was. I wasn't...
and I normally get it when I'm flicking my fingers and I don't even know.
Do you flick your fingers in any way?
They call this flapping with a lot of autism.
I don't know what...
We don't. I know we have some oddities with our way of thinking, but it's not compulsive as much.
Really important to me, as you have sauce like gravy, it's got to be warm. I can't have anything cold, and I can't eat food if it's being cooled down, like pizza. If it goes cold, I can't eat that. And I like quite bland things like sandwiches with no butter on it and just literally just chicken and lettuce maybe. And I could eat the same thing over and over again forever. I mean, I could eat Sunday dinner, like roast vegetables and things forever. Smells are quite a bad thing, and some certain smells make me really annoyed, and then I start to panic or I feel sick, and I get...
I'm just laughing because when Kyle smells dog shit, he wants to puke. Yeah, but I don't think that is. I don't think that
especially
really
when
is.
My brother, when we sleep in the same room and the fan cools him and he farts, it smells horrible. That's the only thing
but I don't think this. I don't think this is really part of autism. It's just smelly shit.
Yeah.
Nervous and I don't know what to do. So depending on what it is, it's not every smell. It's just certain smells that are really potent and it goes straight to my head and I just can't deal with it. I guess this is to do with hypersensitivity in people with Asperger's. Number 5, certain noises and sounds can really affect me. only slightly, only sometimes, only certain noises and certain sounds, and it's really sharp and it goes right into my brain. And I can't concentrate and I get really annoyed, super annoyed. And sometimes I just kind of lash out in anger because that noise annoys me so much. I can't deal with anything else. Like everything gets shut down just because that noise pierces everything. Number 6.
I can definitely relate to this, but I'm pretty sure it's related to my bipolar mood disorder, especially when I'm depressed. I feel like I'm very sensitive to noises and very sensitive to light. The light just seems so intense. The noise, like on a piano, would just sound so intense that I wanted to be a piano tuner, and I couldn't do it because you're constantly hitting the loud note in forte, and it would just scream to me. And I almost felt like ever since I've been on maybe an antidepressant that I don't seem to have a lot of issues with it. I don't know. Did you ever have sensitivity to light or noise?
I think back then when I was tired, when I'm tired, I don't like too much noise. But in general, I actually kind of enjoy sound. I don't like working in silence. I usually have the radio on, the music on, and
the fan,
especially. It's more comforting to me than more of a distraction.
Even our dogs bark a lot.
Yeah,
How often
that doesn't really bother me unless I'm recording my piano stuff, which
is more related to just noise in general.
I hate to say it. I feel like as we got older, our compulsive stuff has not become
as extreme.
Has not become extreme.
We become kind of lazy.
We grew out of it.
A lot of people with Asperger syndrome tend to get quite involved in a certain topic of interest, and for me this is definitely true, and I have a topic of interest with social, economic and global economic issues involving conspiracy theories and UFOs, and I know everything there is to know about it in great detail, and I can remember everything that I read about it. Number 7.
I think wearing the same has some sort of passion. I don't know if you call it I don't know if you want to label it obsessive compulsive, but I have passions for Final Fantasy.
He's a freaking loser. No, that's bullshit. All you are is Yu-Gi-Oh, and
I'd like to play Yu-Gi-Oh. And what about you? Do you feel like you have specific interests in anything else?
I have passions. I don't think they're OCD related. I just enjoy doing it. But Kyle's stupid. His mark is he wants to get perfection on Final Fantasy games, and it's really annoying.
Games in general,
and especially
I'm a gaming perfectionist. I want every.
And especially it's stupid that he wants to get 999 jump ropes in Final Fantasy.
I guess that's obsessive compulsive there. And when I do video editing, it has to be a perfect. I actually feel like I'm actually more particular with my video editing than my brother. My brother doesn't care.
I get shit done. That's all that matters to me. I don't care. I care more about.
I have a more perfectionist type of issues.
But I think this is more related to OCD, not autism.
Type of clothing all the time. I kind of get into comfortable patterns of wearing the same thing all the time, and so my girlfriend kind of helps me pick out different things sometimes to spicing up my clothes line. But I tend to just fall into a routine of just wearing maybe like 3 t-shirts in routine. So that's quite important to people with Asperger syndrome as routine, and I guess I get really comfortable wearing the same clothing. Number 8.
So I can speak about that. I like wearing the same clothes every day, but it's mainly not because
it's convenient.
It's more convenient. I don't like doing wash all the time. It's more about laziness. So I don't know about you. You like changing your shirts every time.
Yeah, but
of course when we go to the gym, we take it out because it's wet and gross.
But we're not really particular in the type of how the cloth.
We used to be, because remember our mom we would take out our clothes.
I hate to say it, most people like me probably hate wool, and I hate the feeling of wool. Too gritty.
It's sarcasm, and I feel that this is a common thing with people with Asperger syndrome is I don't get sarcasm with strangers or people I don't know that well. The only time I really do
the reality is this is why we kind of bring people off, because in reality we just like to get people going. We like
to get them riled up.
We like to get them riled up. So that's why some people think it's autism. Like if we yell in a restaurant, we scream
too loud.
We wear thongs just to do. The thing is, I think my brother and I have a very well-developed sense of humor that some people don't like our sense of humor because it's so
very
dark,
dark
and sarcastic, and
comedic. And
I don't know. So does that mean we're not autistic? Because we have a really.
I have a feeling someone who's truly autistic would not understand our dry humor.
Yeah.
But we understand it to the point that we don't think we're autistic.
We love
sarcasm as if I know the person quite well. If I don't.
even my dad, even my brother. Recently, an example is when we went to the Memorial Day grave of my grandparents, i.e., my dad. My brother pretty much said, "Where's his gravesite?" And even normal people think that's rude, and maybe that's why people think we're autistic, because we think it's funny. All that dark humor we think is funny, and does that mean we're more antisocial? Maybe, I don't know. Keep going.
We have a tendency to push people's boundaries, but not necessarily in a negative way. We just try to
like
draw
doing it.
humor.
We think it's funny, entertaining.
Know them, then it's hard to pick up when they're joking or if they're being serious. This can become a problem, especially if you're in work or a professional environment. So I do have difficulties with this, and I'm sure a lot of you guys will as well. Number 9 is crowded places and busy public places. I'm not a massive fan. I can't deal with myself in big cities. I get very scared and nervous, and I tend to just shut down. It's quite ironic as well, because I play music in a band and I love playing gigs and I love playing to big audiences. But if it was the other way around, if I was in the audience watching myself, it's a different scenario, and I can't deal with it with a lot of people around me all the time. It's kind of overload again, and I get really, really scared and have to kind of retreat back to somewhere that I feel comfortable with. And
You
Can you
know,
relate to that?
we definitely related to that when we were younger. We didn't like talking to anybody. We just kept to ourselves. We're extremely shy, extremely self-conscious, very, very good kids. But for some reason, after our 20s, when we kind of found more of ourselves, where we kind of, I guess people could say we lost it, like making crazy videos and stuff. We just became more true to ourselves, and we just don't. I don't know. I do get anxiety sometimes, but I feel like people really aren't that bad. So in the end, we used to be introverted, but I think we probably became more extroverted.
You know, I hate to say
I'm more
that.
extroverted than my brother, I feel like.
I hate to
So,
say it.
I enjoy people.
I struggled a lot with anxiety, and I think I
It
mentioned
used to be really bad.
I think
used to have agoraphobic. We hated going out.
I think I mentioned this in Josh Hitty's video, Social Anxiety. I think I mentioned to him that, like, I don't know if I mentioned it, but I remember going to this big sports function in a stadium, and I got so anxious and felt so bad about myself. I destroyed my $1,000 keyboard because I felt I would never be able to play live in an audience, because the anxiety I felt from it, it just felt like it would never be possible because the anxiety was just so bad. I remember another time the anxiety got so bad because of the side effects of one of my medications, is that I had a fit and I ended up leaving church and walked several miles. I think you can mention another one.
There's another thing that reminds me of, maybe because we are both. I'm on sertraline, i.e. Zoloft and Trazodone, so maybe it's my meds that really. I'm just not as. I do get anxious. I feel like I get anxious when I have to get a job and work early. That's when I have a ton of anxiety, and I just can't sleep, and I have an insomnia. But other than that, our anxiety really decreased, which could be med symptomatics. Maybe we're on the right meds, I don't know, or maybe we just got used to it. I feel like everyone has anxiety. Everyone is not comfortable putting themselves out there, but the reality is once you just get used to it, just like it doesn't hurt as much.
You know, to be honest with you, I agree with Kyle, because I've been on Latuda since 2014. And ever since then, I pretty much chilled out around crowds and stuff. I do get sometimes anxious, and I do feel like people are judging me, but
I'm very anxious when it comes to approaching women, I'd say, but not as much. I don't like to do it as much. I'm not comfortable with getting rejection. I know it. That's me, I feel like.
But ever since we got into the Korean adoptee community, we're pretty comfortable, and we enjoy getting interviews.
I'll be honest, I get anxious, but it's not to the point where I just don't want to do it like back in the day.
No, I just want to mention this guy seems really, really uncomfortable doing this video, because he doesn't look into the camera at all. Like, he's nervous, and he's twitching a lot with his hands, and I feel like he's definitely not comfortable with this.
Autistic trait.
Which is really weird. I know autistic people have this second sense for music or art or some type of creative endeavor, so it's really interesting how, like, he plays in front of a band but doesn't feel anxiety.
Even I would be pretty anxious doing that, I feel like. That's why my brother and I didn't enjoy performing. I hated it back then.
Number 10, last but not least, a lot of people tell me that I talk too fast. Right now I'm actually trying to talk quite precise and slower than I usually do. But when I get going on a topic of interest or a specific area that I know a lot about, I tend to kind of speed up and talk quite fast, and I guess it's because my brain's running really, really fast and I'm trying to get a lot of information out at any one time, and I guess people don't understand that, and they kind of always tell me to slow down. It gets really frustrating because I don't want to slow down because I'm going to lose what I'm trying to do, but at the same time I guess they can't understand what I'm saying. So this is a big problem, and I don't know many other people with Asperger syndrome, so I don't know if this is a common thing, but this is definitely something that affects me. So thank you for watching my video. Please subscribe to my channel. I'm going to be doing more videos on Asperger syndrome and anything that I can do to help. If you want to get in touch, email me below, and thanks guys, stay tuned.
So about that last bit where he talks about talking too fast, I think it depends on where you live. Because I know if you live in Chicago, they tend to talk fast. I remember I had a teacher do that as well. I used to talk fast, but I realized, and I used to clutter my words a lot. But I think I've become, as I just keep on talking, I'm better at it.
I just want to say, like, when you're manic, you have pressure to speak. You speak like really rapidly, and it's different from when you're autistic, I feel like, because it happens with certain topics. When you're manic, you just simply just spurt things over and over, especially spiritual things or other types of topics that might interest you. It's like a flame that's being lit, and you just speak like that. And downright, I still believe I have bipolar disorders. Downright, there might be similar traits that autistic people experience, but ever since I've been on the right medications, a lot of that issues that I discovered that I used to have are no longer prevalent.
And to be honest, I was so hyped up on getting labeled because the reality is, I think I just wanted an excuse just to be myself. Even though I like wearing our red thongs, a lot of people some people don't like it.
People like this 9 to 5. People like having children, getting married.
This white picket fence.
People like having this beautiful house, white picket fence, and me on the other end. We are so creative. We never followed that routine. Even when we had relationships, things got really disruptive. And a lot of that is due to adoption disorder.
Another thing that really we don't like is we like to tell how it is. We're very honest, and sometimes the information we tell is hurtful, and sometimes it affects other people, but that's just who we are, and some people don't like that. But
being adopted can affect you guys more than
we definitely have a rough edge to our personality.
Because adoptees are like 4 times more likely to commit suicide. There is a statement that's pretty well known in the scientific community that the trauma is stemming from very early childhood. If you're not pampered and taken care of by a mother at an early age, you start to behave very differently from normal functioning adults, and that can affect relationships, your mood. I wouldn't say it's definition to the reason on why you might have a mental illness, but it's a large prevalent area.
An interesting topic on adoptees is I read that a lot of them portrayed in movies are actually more likely to be psychopaths too. So even that I'll name some psychopaths like Loki is adopted. That recent one that's re-released about the psychopath being that came from hiding. I can't remember that. They're just releasing that show. I used to watch it. But there's a lot of adoptees that have issues, I feel like. And they aren't as socially adaptable as some other people that actually know their history.
So is there any last words being diagnosed with autism?
Well, do you feel like you have autism?
I feel like I don't give a fuck about labels.
Yeah, that's honestly what I feel like. We don't want to downplay and disguise. I feel like there's this stereotype where autistics just don't even look at the camera. They just look, but I'll be honest, I still have problems giving eye contact, but maybe that's an Asian thing too.
I don't know if you guys know this, but there's an actor on Hannibal. He actually has autism. What's his Hannibal Lecter? What's his real name? Do you know? You know who I'm talking about? The guy who played Hannibal Lecter?
Yeah, I can't remember his name.
I don't remember his name, but he
won an award recently.
He's actually considered autistic. So there's people out there that are actors.
So you can be normal. You can pretend to be function and normal. So in the end, I feel like as I get older, be careful about labels. Why do you want to box yourself into this of what you think you are when in reality of who you can be?
My number one tip is don't give a fuck about labels. Just be yourself.
Yep. Love yourself. And you'll find people that like you, and you'll find people that don't like you. Then that's just how it is. That's it.
So Kyle's autistic, but he doesn't give a fuck.
I
Is that
actually
right?
feel like, I don't know. I might have some traits of a personality disorder, but I'm not really as focused on saying I have this issue, because I would do that because I would always be afraid of people. I didn't feel like I would get along with them, but maybe it's more like social anxiety. But once I just started doing crazy shit, wearing red thongs, taking off our clothes,
Being ripped all the
being
time.
ripped all the time, we
We
I don't
love
know, we love it. We like the attention. We think it's funny as hell.
when we show our bodies off. So we lost like 85 pounds total. We love getting fit. We're
Ready to go to the gym pretty
bodybuilders.
quick.
We enjoy showing ourselves off with confidence. That might not be most people. We like wearing red thongs.
Even when we were big and fat, we just still like stripping clothes. I don't know what kind of label you get that. Maybe a
We're
defiant
very
disorder.
extreme in terms of
We're-
extremities.
We're out there.
Yeah.
But does that mean we're autistic? I don't think so.
No,
It's just who we are.
We kind of like the spotlight pretty much. So we're definitely maybe have autistic labels, but we definitely don't care.
What do you guys think? What would you label us? Do you think we're normal, or do you think we're abnormal? Leave a comment, like, subscribe, and hit the bell button if you're interested at Beyond Bipolar Blog, guys.
All right, take care. Have a good one. Bye.
Bye.